It's only in Nigeria that government expends so much on residency training.
Exactly. It's a
In
personal
developed
thing.
countries, you pay to undergo residency training. Salaries in Owerri that some of their members are not being paid, so their full salary in Owerri. So yeah, maybe government should look into that. Reintegration of their members into the IPPIS payment scheme. They were the ones that rejected that scheme in the first instance.
Exactly.
Now they're agitating that they want them to be reintegrated. House officers being allowed to join the National Association of Resident Doctors so that they can go on strike. He has said it. They are not a registered union. They shouldn't be allowed to go on strike. Incomplete salary payment in some places, yeah. Universal applicability of circulars on remuneration. Then let me say one thing. In a single industry, why are you paying some people in dollars, you are paying some people in naira? Why am I saying so? You have a different salary structure for other health professionals, another salary structure for medical practitioners. It's only in the health sector you have such. Before Olumide Akintayo in 1991.
Which category are paid in dollars?
No. I just use that as an analogy.
Oh, okay.
Some are on commerce, the others are on commerce. All others.
What's the difference for those of
the commerce is well loaded with goodies. Let me put it that way. It's well loaded as compared to the commerce. And this problem started from the regime of Olumide Akintayo in 1991. Prior to that time, all professionals in the health sector were on the same salary scale. You come in at different levels depending on the job evaluation, and the relativity had been taken care of. Some coming on 7, some coming on 8, some coming on 9, and some coming on 12. But Olumide Akintayo, in his wisdom, decided they must be separated, and he loaded one salary scale with a lot of goodies at the detriment of the other. He set up a health trust fund for the country. Yeah, I think that's okay. Then CMD in all hospitals must be a doctor.
So what is that?
Chief Medical Director must be a doctor.
Who would you want to be a CMD in
any health professional
the most senior,
who is qualified?
Let me put it this way.
So you would like to have a pharmacist as the chief medical
director?
Sure,
as it happens in developed countries. You'll be saying
a physiotherapist,
world best practices. As I'm speaking to you, the leader of the Center for Disease Control in WHO, which is the highest ruling health body in the world, is a lab scientist. What's what I'm talking about? The head of the largest hospital in Canada is a nurse. What are we talking about?
Let me say
have some reactions from home. We have some reactions from home. Kester Peters says the problem of health workers is a foundational problem. No unity amongst them. Then Matthias Oji, if you have one consultant for 5 hospitals, when does he perform surgery? When does he go on ward rounds? When does he do his research? And when does he train? When does he teach in all the 5 hospitals? Are you going to react to that one? In one sentence, if you can.
You know, the idea is not that you have only one. What we are saying is that in some of the units or departments, you have 20, 30 people as consultants. That's what we are saying.
You don't need as many.
You don't need as many as that.
Okay.
You might have 4 or 5 permanent, and then you have some who, you know, even when you're a surgeon, there are still some other subspecialties.
Okay.
And if you are going to have consultants, have hospital-based consultants, not honorary consultants, who
are
primarily employees of the university.
Okay. But it's the College of Medicine of the University of Lagos.
Yeah.
So why can't they not teach in Akoka and also teach in the College of Medicine?
We are not saying that you should not teach.
They can teach. We are talking about providing services.
The consultancy part of it.
Not even the consultancy part of it. The consultancy part of it is allowed. But what happens now is that the services is being saddled, the honorary consultants are being saddled more with the service area in the hospitals instead of having hospital-based consultants. And these honorary consultants, because their major focus is to the university, their major obligation is to the university, so they tend to render less of these services. The loyalty to the hospital.
Okay.
And there are more. UCH, for instance, we have almost 300 honorary consultants as compared to about less than 50 hospital-based consultants. And it's cheaper. It will cost the hospital less money if hospital-based consultants are employed.
Okay,
Now,
well,
AXP
yes.
says there is no need for doctors to feel superior over others in the profession. Healthcare practice is a collaborative process. That's from AXP.
Okay.
Thank you for your
It is
reactions
absolutely-
from home and your
Yeah,
comments.
let me just add one or two from here. I've got Kestas Peters, who says that seriously, the problem of health workers is a foundational problem. No unity amongst them and serious issues of inferiority. Saint Habi says, contributing to education, training, and development of other nurses. I'm not sure what St. Habi is saying there. In addition, nurse consultants are responsible for developing personal practice, being involved in research, okay, contributing to education, training, and development of other nurses. So in essence, St. Habi is saying that there should be consultant nurses rather than not having consultants amongst nurses. There are a number of other things. There should be a 5-year plan of implementing the policy of if you work in public hospitals, don't work in private. I'm sure that some doctors will say they have a right to have a private clinic as well. won't they?
That's part of the problem.
But-
Because what happens when people tell you they go on strike is that they divert clients and patients
As a
in
matter
a
of
guaranteed public sector market, quote and unquote, to private profiteers in private clinics. So, because they are on strike now, when they come back, if they choose to come back after 10 months, government pays them.
Okay.
And then, meanwhile, they're making money in the
As
private
a
clinics.
matter of fact, there's a law against that. It's just that everybody has been turning a blind eye to it.
Well, yes, it looks like someone captured that. Eguado Tony Jeff, he says there is need for government to revert to Buhari regime policy of once you work in the private sector, don't work in public hospitals.
There's a
at
law.
the same
There's a
time.
law against that.
All right, we have to wrap up. Thank you very much.
Okay. We have been chatting with Mr. Segun Shotiloye, a physiotherapist and chairman NUAHP at the UCH Ibadan, as well as Mr. Olumide Akintayo, president, Pharmaceutical Society of Nigeria, and the social commentator, Ugo. Okay, thank you all very much for coming to share your insights with us. And as we said before we started this segment, Dr. Kayode Obembe, who is the NMA president, had actually assured us that he would be with us for this segment, but had to cancel at the last moment due to other commitments. Thank you very much for being with us. Sunrise is not going away yet. We'll be right back with yet another interesting conversation. Please remain with us.